So this is episode 3 of Wellness Unscripted, where we talk everything about health, skin and wellness. And on today's episode, we'll be concentrating on the age group between 19 and 25.
Yeah.
So first question, like, Voila?
Yes.
നമുക്കിപ്പം പീരീഡ്സ് ആവുകയാണെങ്കിലും നമുക്ക് ഗേൾസിനും പൊതുവെ പിമ്പിൾസ് വരാറുണ്ട്. അപ്പോൾ അത് വന്ന് കഴിയുമ്പോഴത്തേക്കിന് ഞങ്ങൾക്ക് ഇവിടെ ഇങ്ങനെ സ്കിന്നിലൊക്കെ പാട് വരികയും അങ്ങനെ കുറേ പ്രശ്നങ്ങൾ വരാറുണ്ട്. അപ്പം ഞങ്ങൾ അതെന്താ ചെയ്യേണ്ടത്? ഇവിടെ കുറേ ഹോം റെമഡീസ് യൂട്യൂബിലാണെങ്കിലും കുറേ ഇൻഫ്ലുവൻസേഴ്സിൻ്റെ ഓരോന്ന് പറയുന്നത്, പക്ഷേ എങ്കിൽ ഒരു ഡോക്ടറിന് പറയണതിൻ്റെ അത്രയും വരില്ലല്ലോ. അപ്പം അത് ഞങ്ങൾ എന്താ ചെയ്യണ്ടേ?
ആ കുട്ടി വളരെ വിഷമത്തോടെ ഞങ്ങൾ എന്താ ചെയ്യേണ്ടത്. സോ ബേസിക്കലി it's a part of your life wherein this whole period cycle or menstrual cycle happens, and after your ovulation there leads to a dip of estrogen levels. Estrogen is one of your female hormones. Okay, so either indavuna samayathu there will be a energy crash, there will be low serotonin levels, so mood swings varam. Adinte kude thane varuna sambhavana. Yes, PMSing, don't irritate me, I am in that zone എന്നൊക്കെ പറയുന്നത്, the red zone. So ആ സമയത്ത് you will have insulin fluctuations in your body, which leads to sugar cravings, etc. Along with that, one thing that happens is that your sebaceous glands become hyperactive. This leads to clogging, acne, and acne leads to post-acne scars, all of that. Now, where do you tackle this? One, making sure that you have a good exfoliant in your routine, so there's no clogging that's happening. 2, making sure that you have the right amount of hydration internally as well as externally, so that hypersebaceous secretion doesn't cause clogging. 3, making sure that you have some sort of, suppose ഇപ്പോൾ നമ്മളൊരു PCOS അല്ലെങ്കിൽ അങ്ങനെ എന്തെങ്കിലും ഉള്ള, അല്ലെങ്കിൽ ഒരു ചെറിയൊരു ഹോർമോണൽ ഫ്ലക്ച്വേഷൻ ഉള്ള ബോഡിയാണ്, നമുക്ക് പ്രെഡിക്റ്റ് ചെയ്യാൻ പറ്റുന്നില്ല ഏത് ടൈമിലാണ് പീരിയഡ്സ് വരാൻ പോകുന്നത്, അങ്ങനെയുള്ളവരാണെന്നുണ്ടെങ്കിൽ they can have supplements that will help in regulating this, insulin sensitivity in their body. ഇതിലെല്ലാം ഏറ്റവും important is the diet. So making sure that after your ovulation, that is after your 14 to 15 days, that you follow a very neat and clean diet. This will help in preventing breakouts during that time.
Yeah.
This is something that I'm
someone who experienced that, actually.
I was just going to say. This is something I have personally experienced, because I was someone who never had breakouts.
I always had breakouts over here and on the nose, the tip of it, or something like that. It was always there, but just like this, like after the ovulation, when you're like very clean with your eating pattern, especially cutting down on fried foods and sweets, like you said, it was the main cause for having that acne around.
And how did you find out about this?
It was something that I randomly read about, about this. There was something about seed cycling or cycle eating or something like that. I read about it, and then I just wanted to try it. I mean, nothing harm in just trying to eat good.
That's because you had that thirst for knowledge, that you went behind it or you read about it. It's sad that people don't talk about it. All that they say is you do 3-step routine, 4-step routine, 16-step routine. പക്ഷേ ഈ ഒരു ഇങ്ങനെ നമ്മളുടെ whole human body runs on cycles. You have a circadian rhythm, you have a sleep cycle, you have a digestive cycle. Similarly, your menstrual cycle is a rhythm. So you go with the flow and you listen to that flow. So after ovulatory period, നമ്മളുടെ ആ ഒരു സൈക്കിളിന് അടുപ്പിച്ചുള്ള ഒരു 1 week അല്ലെങ്കിൽ 2 week, making sure that you eat less oily food, that you cut down on sugar. You're going to have a glucose spike or an insulin fluctuation. Making sure that you follow a very minimal routine, because your skin might feel a little oily during that time, especially in this age group. So keeping it very clean, neat, instead of overburdening it. അയ്യോ എനിക്ക് കുരു വരും, എന്നാൽ ഞാനൊരു 3 ക്രീമും കൂടെ തേക്കട്ടെ, അങ്ങനല്ല. So listening to your skin,
basically the diet, which really helps.
which really helps, and that is something that
water intake also.
Water intake. Another thing that we don't talk enough about is canned food and drinks, especially things like Diet Coke. It is not sugar free. Even though it is endorsed as sugar free, and even if it is endorsed as sugar free, it is still going to cause all of this harm to your system.
Body, yeah.
So making sure you eat clean, and whatever acne you have that the girl is facing now, or that age group is facing now, if they have acne currently, clearing that out, and then making sure as a preventive measure they, follow a proper routine helps.
And also with regards to menstruation, I am a person who believed or still believes that if you don't get your cycle on time, or you have a longer periods or something like that, I feel like it has something to do with your your system. Something is wrong in your system, that's why this happens. So I've had friends who have not got their periods for like almost 6-7 months, and they're okay with it. They're saying, yeah, it'll
One less thing to worry about.
And there are some people who carry it forward for like 30-40 days, and they're okay with that also. So if there is somebody watching this and they are going through something like this, what would you want to say to them?
Listen to your body. That's what I always say. I am a person...
No, I'm asking, is that okay to
It is not okay.
Okay.
I am a person who's sitting here now because I listened to my body at one instance. So whenever you have unusual hair growth, whenever you have unexplained weight gain, when you have your menstrual cycle that's being lapsed, or when you have irregular uterine bleeding, address it. Go
Immediately,
immediately.
Yeah.
Go get a scan done. I recently diagnosed ovarian cyst that I had, and I had to immediately get that removed. One question that the doctors who did the surgery for me asked is that, how did you find out about it? It was too early. You didn't have much of symptoms. But I could see some changes in my body because I'm a person who listens to my body. Like if I feel low, I know there is something going on. So I think we all know, but we ignore it.
Ignore it, yeah.
Yeah. So
this is like a very simple thing. You don't get your periods on time.
And recently, I think 2 days back, I spoke to one of my patients. I was just telling them that, females are blessed with this cycle because if something is happening wrong in your body, you have the sign.
It's a signal, yeah.
Yeah. You have that monthly signal that, okay, look into it. Men won't realize it until they go bald or they gray.
Yeah.
So this is something that, your body is telling you.
Which is giving you a signal, and
address
not
it.
Ignore it, yeah.
Look into it. Do what needs to be done. Instead, don't be scared to look into it. Right? Like if you have to get a scan done, go get a scan done. Whatever it is, with today's day and age, you can easily address it and you can easily tackle it. But ignorance is not bliss.
Over here.
Yeah.
And also this facial hair. Like there are like a lot of people who have like, they get it as they age. Stronger, facial hairs, and, on the upper lip and under the chin and all that. So what is the reason for that?
Hormonal imbalances, hormonal fluctuations.
So ordinary alkar, immediately what they say is, enki PCOS unda. Enki PCOS are. So is it only because of PCOS they get it? Okay.
It is not only
what
because
are the other
of PCOS, adenomyosis, endometriosis. There's so many conditions out there, that can lead to thyroid fluctuations. Doesn't have to always be related to your uterus also.
Okay.
Even thyroid fluctuations can lead to hair fall, unwanted hair growth, etc. So making sure that you know what it is. So in the consultation വരുമ്പോൾ ഈ ഒരു ഏജ് ഗ്രൂപ്പിലുള്ള കുട്ടികൾ തന്നെ ചിലവർ ആക്നെ ഉള്ളവർ ഞാൻ എങ്ങനെയുണ്ട്, ഹൗ ഇസ് യുവർ സൈക്കിൾ എന്നുള്ള ഫസ്റ്റ് ചോദിക്കുമ്പോൾ ഡോക്ടർ എനിക്ക് PCOS ഉണ്ട്. അപ്പോൾ I asked them that have you done a scan? ഇല്ല ഡോക്ടർ, എനിക്കറിയാം ഇങ്ങനെ ഇറഗുലറായി ഇതായി. അപ്പം get it diagnosed. You might. And one thing that we have noticed is most of the women who doesn't know that they have PCOS, we have diagnosed them with PCOS. Like some 70% of people who have told us they have PCOS,
they don't have it.
Their uterus and ovaries.
So what do they have to do? You have to give them a proper guideline. What would it be? Go to a gynac?
Go to a gynac. So see, if you know there is something that's happening out of normalcy, go to a specialist. If it is related to your, uterus, or if it is related to your menstrual cycle, go to a gynac, the gynac will tell you if it is their place to talk, or if you have to be referred to a endocrinologist or a hormone specialist, and get the right guidance. And most of the time these doctors won't tell you, especially now, they won't tell you to take pills. Like I have good friends of mine
were on contraceptive pills for, just because they start getting facial hair, it's like immediately they connect it to PCOD, and then it's like, take contraceptives.
And contraceptives
it was
easily,
like a hype.
It was a hype, and contraceptives are easily available over the counter these days. So they feel, I'll just have this for like 3-4 months, so that correct time periods out, I don't have to worry anything about it. No, that's not the way to go about it. I have good friends of mine who are endocrinologists who doesn't prescribe medicines unnecessarily. സോ ഈ ഒരു ചിലർക്കൊരു ഇതുകൊണ്ട് എന്താ, എന്തെങ്കിലും ഒരു ഡിഫറൻസ് ഉണ്ടെങ്കിൽ ഞങ്ങൾ പോയി കഴിഞ്ഞാൽ അവരുടെ ജീവിതകാലം മുഴുവൻ ഞങ്ങൾ മെഡിസിൻ കഴിക്കാൻ പറയും. നോ. So that is again your choice. You see a doctor, you get the information, and then you speak to them. Let them help you. Don't blindly follow anything and everything that is there on net or ChatGPT.
Yeah. So we'll move to the next question.
നമുക്കിപ്പോൾ ഓരോ പിമ്പിൾസ് വരുമ്പോഴും മുഖത്ത് നിറയെ ഡാർക്ക് സ്പോട്ട്സ് വരാറുണ്ട്. അപ്പോൾ ഡാർക്ക് സ്പോട്ട്സിന് ആക്ച്വലി യൂട്യൂബിലൊക്കെ ഒരുപാട് ഹോർമോണീസ് ഉണ്ട്, വിത്തിൻ 2 days, വിത്തിൻ 3 days എന്നൊക്കെ പറയും. പക്ഷേ അതൊന്നും ലൈക്ക് പോകുന്നില്ല. അപ്പോൾ ഒരു ഡോക്ടർ എന്ന നിലയിൽ എന്തെങ്കിലും solutions ഉണ്ടോ?
Also, this is a doubt that, I think all the age group has dark spots, pimples vanu കഴിഞ്ഞാൽ, the marks are left behind. What to do about that?
So again, as she mentioned, within 2 days, within 3 days, ഒരു സ്പോട്ടോ ഒരു പിഗ്മെന്റേഷനോ ഫെയ്ഡ് ആവാൻ പോകുന്നില്ല. ഈവൻ നമ്മളൊരു ട്രീറ്റ്മെന്റ് ചെയ്താൽ പോലും it will take,
a while.
Yeah, like 1, 2 or 3 weeks for it to fade. But that fast forwards it. However, what can you do at home to reduce this? One, what is a pigmentation? That is, ഒരു ആക്നെ വന്നിട്ട് വരുന്ന പിഗ്മെന്റേഷൻ ഇസ് എ പോസ്റ്റ് ഇൻഫ്ലമേറ്ററി ഹൈപ്പർ പിഗ്മെന്റേഷൻ. ഒരു ഇൻഫ്ലമേഷൻ വന്നതിന് ശേഷം വരുന്ന പിഗ്മെന്റേഷൻ ആണ്. ഇൻ ദ ഫസ്റ്റ് പ്ലേസ് ആ ഒരു ഇൻഫ്ലമേഷൻ വരുമ്പോൾ അത് കറക്റ്റ് രീതിയിൽ ഹീലായി പോവാനുള്ള കാര്യങ്ങൾ നമുക്ക് ചെയ്യാൻ പറ്റും. ലൈക്ക് ആക്നെ സ്പോട്ട് ഓയിൻമെന്റ്, സ്പോട്ട് ട്രീറ്റ്മെന്റ്സ് എക്സെട്ര. സോ അവിടെ അത്രയും ഡീപ്പർ സ്കാർ വരില്ല. പൊട്ടിച്ച് കളയാതിരിക്കാൻ പറയുന്നത് അതുകൊണ്ടാണ്. രണ്ടാമത്തെ കാര്യം, then soon after that acne heals, using some depigmentation cream which is given to you by your specialist, that helps in calming down that pigmentation and fading it off without leaving a scar permanently. Thirdly, having exfoliants in your routine really helps.
Toners പോലെ.
Exfoliant toners. Toners രണ്ട് ടൈപ്പ് ഉണ്ട്. ഹൈഡ്രേറ്റിംഗ് ടോണേഴ്സ് ഉണ്ട്, എക്സ്ഫോലിയേറ്റിംഗ് ടോണേഴ്സ് ഉണ്ട്. സോ എക്സ്ഫോലിയേറ്റിംഗ് ടോണേഴ്സ് പോലത്തെ ടോണേഴ്സ് നോട്ട് റെഗുലർലി, once or twice a week ഒക്കെ യൂസ് ചെയ്യുന്നതും എക്സ്ഫോലിയേറ്റ് ചെയ്യാനും ആ ഡെഡ് സ്കിന്നൊക്കെ കളയാനും അപ്പോൾ പെട്ടെന്ന് പിഗ്മെന്റേഷൻസിന് അതൊന്ന് അബ്സോർപ്ഷന് ബെറ്റർ ചെയ്യാനൊക്കെ അത് ഹെൽപ്പ് ചെയ്യും. ഇത് കൂടാതെ വെരി ഇമ്പോർട്ടൻറ്റ്, സൺസ്ക്രീൻ. Because any pigmentation gets darker with sun exposure, with blue light exposure. So using a sunscreen. ഫോൺ. അപ്പൊ എല്ലാരും പറയും ഞാൻ പുറത്തിറങ്ങാറില്ല ഡോക്ടർ, ഞാൻ ഫുൾ ടൈം വീട്ടിലാണ്. വീട്ടിൽ നമ്മൾ
എന്താ ചെയ്യുന്നത്?
അതെ, നമ്മൾ മുഖത്തോട് പോകാൻ നോക്കിയിരിക്കല്ലോ. We are either on laptop or phone or TV. People hardly talk to each other these days. So using a sunscreen that suits your skin, really helps in preventing deepening of pigmentations. And that why? Because അവിടെ ഒരു പിഗ്മെന്റേഷൻ ഉള്ളത് അത് ഹീൽ ചെയ്ത് പോകുന്ന ടൈമിൽ വേറൊരു ഡാമേജ് വരാതിരിക്കാൻ ഒരു സൺസ്ക്രീൻ ഹെൽപ്പ് ചെയ്യുന്നു. I'm not vouching for one product, but I'm saying what it does.
Even if you're staying indoors, wear sunscreen.
Even if you're staying indoors and you're having blue light exposure and you're a person who has pigmentary concerns, wear sunscreen. Have vitamin C supplements. Vitamin C helps in excreting hypermelanin from your body. It helps in breaking down excessive melanin and excreting it out. So having vitamin C supplements, having good antioxidants. ഇപ്പം നമ്മൾ ഈ പറഞ്ഞ പോലെ പൊമഗ്രീനേറ്റ് അങ്ങനത്തെ ഒക്കെ ആണെങ്കിലും അല്ലെങ്കിൽ ആന്റി ഓക്സിഡന്റ് സപ്ലിമെന്റ്സ് ആയിട്ടാണെങ്കിലും നല്ലതാണ്. പിന്നെ ബേസിക്കലി ഇത് പ്രിവെൻഷൻ മുതൽ തുടങ്ങണം. നമ്മളിപ്പോൾ നേരത്തെ പറഞ്ഞ ക്വസ്റ്റ്യൻ പോലെ before your acne sets in, എന്ത് ചെയ്യാം? Okay, acne വന്ന ഉടൻ എന്ത് ചെയ്യാം? അത് കറക്റ്റ് ആയിട്ട് ഇങ്ങനെ
first thing. I think everybody, ചില ആൾക്കാരൊക്കെ I know safety pin ഒക്കെ വെച്ചിട്ട് I used to have people like that in my college who used to do that.
സേഫ്റ്റി പിൻ വെച്ചിട്ടുള്ള ഒന്ന്. I know people who rub it with a towel saying, I just rubbed it with a towel, I didn't pop it. So that's again, will you do that to an open wound?
Yeah.
So treat it like a wound, treat it like an infection. You know, let it heal, give it the time to heal, dry it out. Don't pick on it, don't poke on it, and you know.
The more you touch on it, I think the mark is gonna like.
So pimple patches and the chia. Pimple patches doesn't magically vanish off acne or pimple. നമ്മൾ അതിനെ ടച്ച് ചെയ്യൽ കുറയും. ഒരു പാച്ച് ഒട്ടിച്ചു കഴിഞ്ഞ് കഴിഞ്ഞാൽ ഒന്ന് ഇറ്റ് അബ്സോർബ്സ് ഇൻ, ഇഫ് ഇറ്റ്സ് എ കൊളോയിഡൽ പാച്ച്, ഇറ്റ് അബ്സോർബ്സ് ഇൻ ദ മോയ്സ്ചർ ആൻഡ് നമ്മൾ പിന്നെ അതിൽ പിക്ക് ചെയ്യില്ല. So that helps it stay sterile for a while. That's what it does. It is not an acne medication. But if it is someone who finds it very hard to pick on the acne, let them use a pimple patch, it's okay. But don't pick on your acne. Make sure you use prescription creams to, you know, bring this down. Especially acne ആവുമ്പോൾ വേറൊരു പിഗ്മെന്റേഷൻ ആണെങ്കിൽ നമുക്ക് ഈ സീറം എന്നൊക്കെ പറയാം. പക്ഷെ ഓരോരുത്തരുടെ സ്കിന്നിനും use ചെയ്യുന്ന pigmentary compounds would be anti-pigmentation compounds or depigmentation compounds might be different.
Okay.
So following that helps in fading it off faster.
Okay, so basically it's according to the skin type.
Yeah.
So
and
how would they know
uh,
which skin type they have? Do they have to come to the doctor for it?
Not necessarily.
But nowadays എല്ലാരും ഇങ്ങനെ like, you know, picture ഗൂഗിളിനകത്തൊക്കെ നോക്കിക്കഴിഞ്ഞാൽ it's like T-zone, മറ്റേ കോമ്പിനേഷൻ സ്കിൻ ആണ് എനിക്ക്.
I'll tell you one. ഇപ്പൊ നമ്മൾ സലൂൺസിൽ വരെ കാണുന്നുണ്ട് facial analysis machines. If you go to a specialist and if the specialist is good enough, they don't need a facial analysis machine to tell you whether you have a dry skin, oily skin or a combination
T-zone.
skin. Yeah.
Acne prone.
Here we have these mini pores, itra centimeter. Simple. Your skin is dehydrated. It'll have open pores or it'll be oily. If it is oily, that is also a sign of dehydration. If it is well hydrated, it will be healthy.
Okay.
So you don't need a facial analyzer to, you know,
to understand.
Yeah, that is just a fancy tool that I can just use to make you understand this a little better. But it is not for my understanding. So definitely if you are not able to understand what your skin type is, for example, നമ്മളുടെ സ്കിൻ നമ്മൾ ഫേസ് വാഷ് ചെയ്ത് കഴിഞ്ഞ ഉടൻ തന്നെ പെട്ടെന്ന് വലിയുന്ന ഡ്രൈ ആയിട്ടുള്ള മോയ്സ്ചറൈസർ യൂസ് ചെയ്തിട്ടില്ലെങ്കിൽ വലിയുന്ന ടൈപ്പ് ഓഫ് സ്കിൻ ആണെങ്കിൽ that is a dry skin. You wash your face, you feel your skin is okay, normal, and it stays normal. It's a normal skin. You wash your face, it's okay, but then it turns extremely oily later. It's an oily skin. That is a very easy way to understand your skin type. Now, people have combination skins. Some might have oily cheeks and, you know, dry T-zone, or some might have oily T-zone and dry cheeks. As one thing I've noticed is as we age, your skin tends to be more on the dry side because of your female hormones for females. And less on the oilier side, but vice versa, it can also happen the otherwise. So ഒരു ക്രീം, ഏത് ക്രീം അപ്ലൈ ചെയ്താലാണ് അല്ലെങ്കിൽ ഏത് ഹോം കെയർ റെമഡി അപ്ലൈ ചെയ്താലാണ് 3-4 ദിവസത്തിൽ എൻ്റെ ആക്നെ മാർക്ക് പോവാന്ന് ചോദിച്ചു കഴിഞ്ഞാൽ there is no magical remedy.
Okay.
And if anybody tells you there is, please question that. So yeah, that's what I would say.
Okay, so next one.
Yeah.
ഇപ്പോൾ നമ്മൾ ഷൂട്ടിനൊക്കെ ഇങ്ങനെ വെളിയിലൊക്കെ വരുന്നതുകൊണ്ട് ഫുൾ നല്ല വെയിലൊക്കെ കൊള്ളുന്നതുകൊണ്ട് നമ്മുടെ സ്കിന്നിന് കുറച്ച് ഡാമേജ് ആയിട്ട് ഫീൽ ചെയ്യാറുണ്ട്. സോ പെട്ടെന്ന് ഒരു ഡീറ്റാൻ വരികയാണെങ്കിൽ ചെയ്യണമെന്നുണ്ടെങ്കിൽ എന്താ ചെയ്യേണ്ടത് എന്നുള്ളൊരു കൺസേൺ ആണ്.
So this question is like post the tan, what do you do?
ആൻഡ് ഡീറ്റാൻ ചെയ്യണമെന്നുണ്ടെങ്കിൽ അല്ലെങ്കിൽ അതിന് വരികയാണെങ്കിൽ എന്താണ് ചെയ്യേണ്ടത്?
ഇപ്പൊ എല്ലാ പാർലേഴ്സിലും they do a detan എന്ന് പറഞ്ഞിട്ടൊരു ഫേഷ്യൽ ഇത് തന്നെ ഉണ്ട് എവറിവെയർ യു ഗോ. അല്ലെങ്കിൽ നമ്മൾ ത്രെഡ് ചെയ്യാൻ വേണ്ടി പോയാൽ തന്നെ ഫേസ് കുറച്ച് ടാൻ ആയിട്ടുണ്ടല്ലോ എന്ന് പറഞ്ഞിട്ടൊരു there is a conversation regarding that. Yeah. So is that helpful?
So what does these creams or solutions that you use for a facial helps? All of this will have slight bleaching agent in it. Or it might have, medifacials, it will have agents that has exfoliation factor. Our skin dead skin layer, tan skin exfoliate, brighten up, help you. On the other side, if it is parlor facials or etc., they might use a bleach kit. That basically helps in bleaching.
Or instant brightness and all that.
Instant brightness, etc. So what I would say is, I am of the opinion, if you have excess of sun exposure, extreme sun exposure, don't do anything for the next 2 days. Don't go for bleach, don't go for medifacials, just let your skin calm down a bit. Especially don't go for lasers. Because there are a lot of people who come and ask us that laser toning helps in giving that bleached look. Okay? Laser toning helps in improving your or evening out your complexion a bit. Can I do that? No. You've had sun exposure, which means your skin needs a little bit of recovery time. So give it a day or two. In that day or two time, make sure you hydrate it really well. Don't use any actives, especially no retinols, no salicylic acid, no AHAs, BHAs. Hydrate, use ceramides, peptides, hyaluronic acid, moisturizing agents, let it calm down. Use cold water. Use ice packs if you want. Use good sheet masks which has antioxidants in it. Then you can come and get a good, oxygenio or oxygenation treatment, or, jet cleanse, which helps in like cleansing of your pores, or phototherapy. Which is basically intense pulse light of different wavelengths.
The red light and all that?
Red light is LED light therapy. This is intense pulse light, which is basically you will have flashes of light that you see. This helps in calming down the hypermelanin activity in your skin, reducing the redness in your skin, toning down that, excess of pigmentation. So, is sun exposure ippo tan ആവുന്നതിന് മാത്രമല്ല ചെയ്യുക. ഭാവിയിൽ ഒരു melasma അല്ലെങ്കിൽ ഒരു pigmentation വരുന്നത് വരെ excess of sun exposure can cause. Melasma doesn't pop up one day. That hyperactive melanin is later leading to all of these sort of pigmentation. So these sort of management helps as a preventive as well as a curative measure. So that is what I would recommend, especially after outdoor shoot or, an outdoor activity. Just give your skin 2 days of love to calm down, and then you go for the repair and rejuvenation. Don't jump the gun into repair all of a sudden.
And also, I think tan ഒക്കെ വരുമ്പോഴത്തേക്ക് what happens is everybody is into glutathione shots, like IV എടുക്കുക. IV എടുത്തു കഴിഞ്ഞാൽ ഉടനെ there's a glow that's going to come and all that. So what do you have to say about that? Does it help with tanning?
So see, it doesn't help.
It is still a topic of conversation because there are a lot of people who still think this glutathione helps in, getting a fairer complexion.
That is because, the physiology of it is not spoken about much. So what happens when you take glutathione? You have better liver health. You have better internal organ health. That leads to better quality of skin, better quality of pore, better pH levels of your blood, or better pH of your skin. So this leads to an even complexion. So the healthier or well detoxed your liver is. We see, put a fatty liver, grade 2 or grade 3 fatty liver, or liver cirrhosis, hyperpigmentation or a toned down complexion. So that is because their liver health has directly something to do with the complexion. So these glutathione shots that you take, or first of all, glutathione is not taken alone. It should be taken with other antioxidants that facilitate its absorption, like L-cysteine, etc. It is taken per kg of your body weight. So it is taken 40 mg per kg of your body weight. So I do not understand taking these 600 mg tablets and popping it daily. How is it going to be effective in long run? So if you're someone who needs a solution, you need to understand your concern, convey it, and then take the solution for that. So I would say glutathione shots work ചെയ്യില്ല എന്നല്ല, അത് work ചെയ്യും, പക്ഷെ it will only give you a clearer complexion of your own complexion.
Yeah, and it's also something that's not like a one-time treatment, right?
No.
It is something.
It is not a one-time treatment, because you cleanse your liver now, you cleanse your internal organs now, and you have a good routine, you have a good healthy lifestyle, fine. But you are still abusing your, you know, internal organs. You're having junk food. This is like a maintenance that you'll have to have.
Yeah.
Which is why some people say, I've taken glutathione IV, but I've not seen, you know,
Any result,
changes, doctor. Appo njan endha cheyande? Njan iniyum glutathione IV ividunnu try cheyano? Ado endana cheyande ennokke. So they might have tried in different places and then come to us asking, should they again restart?
Continue,
Yeah. So what I tell them is that, see, it is not about how many shots you took. It's about the combination that you took. It's about the percentage of ingredients that you took. Is it for your body weight? Because nowadays you see clinics selling single shot, double shot, triple shot.
And combo offer.
So,
I've been seeing that quite a lot.
So നമ്മളുടെ ബോഡി വെയ്റ്റിന് വേണ്ട അത്രയാണ് നമ്മൾ എടുക്കേണ്ടത്. നമ്മളൊരു പീഡിയാട്രിക് ഡോസ് എടുത്തിട്ട് നമുക്ക് അതിന് റിസൾട്ട് കിട്ടാൻ പോകുന്നില്ല. So that is very important. So making sure that you take the right amount of dosage that is required for you, you're given the right amount of dosage, making sure that you have a proper follow-up. That is, you know, you drink enough water, you eat good food, you follow a healthy lifestyle. You have daily antioxidant supplement or whatever supplement that is required for your body. Clear your deficiencies. All of this together gives you a brighter complexion. And that is your own complexion that is enhanced.
Okay.
So glutathione is not a whitening supplement. It gives you clarity of skin, which you have maybe lost over a period of time.
And it's an antioxidant.
And it is an antioxidant. It is one of the antioxidants which is very well hyped about these days.
Yeah. And also, in your age group, if you have to ask them to take a blood test of, you know, like deficiency in the canary, ഒരു basic, like ഒരു normal ഒരാൾ വരുവാണെങ്കിൽ, what are the kind of deficiencies that you normally see in them?
I always ask them to check their multivitamin parameter, their vitamin D, serum B12, iron, ferritin, magnesium, calcium, these things with their HB. Now, if it is someone who shows some hormonal imbalances or some signs of, you know, low energy levels, ingenekka parayunnundu, hair fall parayunnundu annundengil, some basic hormonal tests also we recommend. Like maybe their, you know, thyroid hormones, their insulin levels, their prolactin levels, cortisol levels. ഇതൊക്കെ അപ്പം ഈ ഒരു ബേസിക് ഇതിൽ തന്നെ നമുക്ക് അറിയാം എന്തെങ്കിലും ഡെഫിഷ്യൻസീസ് ഉണ്ടോ ഇതുണ്ടോ. സോ പിന്നെ ഡിപ്പെൻഡിങ് ഓൺ ദ പീപ്പിൾ, ലൈക്ക് ഇപ്പൊ ഈ ഏജ് കാറ്റഗറിക്ക് that is enough. Now if it is someone who has not done blood tests in their entire lifetime, then I would just ask them to have a look at their, you know, other parameters also, like the once in a while. Complete blood test, but otherwise nothing to really panic about. Yeah.
Next question.
Yeah.
ഇപ്പൊ ഒരു കിഡിനാണെങ്കിൽ പോലും ഒരു ലൈക്ക് അധികം ഏജ് ഒന്നും ഇല്ലാത്തതാണെങ്കിലും യൂസ് ചെയ്യാൻ പറ്റിയ സ്കിൻ കെയർ റൂട്ടീൻ എന്താണ്? ലൈക്ക് യൂസ് ചെയ്യാൻ പറ്റുന്ന ബ്രാൻഡ്സ് ആൻഡ് സ്കിൻ കെയർ ലൈക്ക് സൺസ്ക്രീൻ ബേസ്ഡ് തിങ്സ് ഒക്കെ.
So products in area, for the other age group, for kids, we already mentioned few of them because they don't need a lot of products. But this age group are people who have a lot of concerns, like, you know, like we mentioned about acne, pigmentation, and all those kind of things. So if you have to mention a few products, like you also mentioned about exfoliant toners and all that. So can you mention some products that they can use, which is not over the budget also?
That's a very tricky question because I shouldn't be endorsing any brand.
I know, but
So, see, there are basic brands that are easily available over the counter that also follows certain set of values when it comes to their formulations. Like Avene is a good brand, Cetaphil is a good brand. We have some homegrown brands also like Gunam, which have
I know. Lovely.
And their exfoliators are good. So same ഒരു formulation exfoliator, if they have to buy from a different brand, it might be not a very pocket friendly option. Pinne, there are CeraVe is a good brand. CeraVe has again exfoliators and they have active serums, etc. Paula's Choice is again a good brand. Paula's Choice exfoliator is good. Yeah, the AHA, BHA exfoliator is good. Their Ezilac Boost is very good for acne-prone skin. But again, as I mentioned, seeing this, I don't want any of them to go out and buy products and try on their skin unless recommended to them by a doctor. So you can always buy products which I would say is easy on fragrance. I do not recommend using products which has very high fragrance because it could be an irritant for you. Don't use products that has high amount of oils, especially for this age category, because moisturizers that has different types of oils, etc., could clog their pores. Don't experiment a lot. If you're using something and that particular product has been working for you, and now the mati nokka. Don't do that. Stick to it. It's working for you. Don't make that another thing for you to worry about. And making sure that even when you use a product, use it very hygienically. Like, don't touch on the tip of your serum all the time. Keep it closed properly so it doesn't oxidize and then
oxidize. Okay. Do you want to talk a little bit about the oxidation? Because I think a bottle until it's over, people use it. They don't notice the color changing or anything of that sort.
So that's very important. Like, you buy a can of milk, it starts smelling bad. You throw it, right? So which is why when you buy a product, if you're living in a hot climate, you either store it in your refrigerator or you store it in a cool and dry place. And if it is changing in color or consistency, if it was prescribed to you, you check with the doctor, is this normal to use? If not, toss it, get another piece. Again, when you vitamin C, retinols, ingante serums പെട്ടെന്ന് ഓക്സിഡൈസ് ആവും. അപ്പൊ വിറ്റമിൻ സി ഒക്കെ ചില വിറ്റമിൻ സി നമ്മൾ മേടിക്കുമ്പോൾ ലൈറ്റ് ഭയങ്കര ഒരു മൈൽഡ് യെല്ലോ കളർ ഉണ്ടാവുള്ളൂ. പിന്നെ ഇറ്റ് ബിക്കംസ് ബ്രൈറ്റർ യെല്ലോ, ദെൻ ഇറ്റ് ബിക്കംസ് മേ ബി ഒരു ബ്രൗണിഷ് കളർ. So then you tend to feel slight itching on the skin. Don't wait for all of that. Like, don't use it if it is the color has changed. That means the potency of the product is not what is mentioned on the bottle. It has changed. The formulation might have been, compromised. So making sure that consistency and everything is the same. There are some people who would buy one cream and
use it.
Yeah, they might not even check the expiry date. And like, it's a moisturizer. It's okay.
Even with makeup products, they use it.
Especially these days, makeup products sometimes might be very expensive. So what they do is, okay, it's expensive. No, I'm going to sanitize and use it, or I'm going to cut where it is rotten. No, you can't do that. So then, if you're a person who are not using it quite often, buy mini sizes, buy small sizes. Don't buy a whole palette, buy a small palette. And use it to the fullest. But certain things you have to say goodbye to when you have to say goodbye to.
And washing the makeup brushes, these are things I don't see a lot of people doing it.
So if you want your makeup products to also last long, make sure you keep your brushes also clean. So the mold,
the compact powder, the sponge inside that is as it is from when they bought it. It is there.
I know. I have seen that. Like MAC മേടിക്കുന്ന compact ഉണ്ട്, അത് ആ compact തീരുന്ന വരെ അവര് ഇതിന്റെ കൂടെ കിട്ടിയ you go to MAC itself. You ask them, they'll give you another sponge. So I have personally asked them this, like, so either kind, like, if it goes, I need the same consistency, they're like, you come back to us, we'll give it to you complimentary. You don't even have to pay. You need and another thing that they say is, suppose you're sharing mascaras, okay? You're sharing a mascara with your friend, and you get these disposable spoolies. Can you always use that? Because even, eye makeup, you have to be very careful. You can always get infections and stye and all of this by sharing your, makeup, brushes, your mascaras, all of that.
Mouth ulcers. I've seen a lot of people, complain about lipsticks.
So all of that is, you can take it for granted until it happens to you. So why wait till it happens to you? So that that is a very important.
It's an awareness that I think people need to have more than,
And every time you use your own lipstick, before you put the cap on, just wipe it on your hand because your saliva is there on that lipstick.
Yeah.
If you can go one step ahead, just sanitize it.
Yeah.
Which I don't think everybody would do.
Yeah.
So just at least wipe off with a tissue on top.
And
so
when
that
you're going to try the makeup products in the shops, I see people putting it directly on their face, and I want to go and tell them don't do that because
പാവം കുറെ ആൾക്കാർക്ക് അത് അറിയാത്തത് കൊണ്ട് ആണ്. അപ്പൊ അവര്
ഭയങ്കര innocent ആയിട്ടാ ചെയ്യുന്നത് because they want to see the color on their face, but
ഇതിങ്ങനെ അല്ലാണ്ട് പിന്നെ എങ്ങനെ ഇടുക
എങ്ങനെ അറിയുന്നത്. But these are like you can always
അപ്പം so ഇപ്പൊ I have seen ഈ ബ്യൂട്ടി ഡിപ്പാർട്ട്മെന്റിൽ നിൽക്കുന്ന കുട്ടികൾ they come with a brush and they tell them use this. പക്ഷേ ഈ mistake at one point I have also done. When I was a teenager, I have also done this mistake. But then later I realized it myself, and I was educated the fact that you get these brushes, disposable brushes or Q-tip. And then you can apply it on your lip. You can see the same shade. So അത് എനിക്ക് തോന്നുന്നു അതിനെ കുറിച്ച്
ഓരോ ഷോപ്പ് ഓരോ ഷോപ്സിൽ പോകുമ്പോൾ ഓരോ കിയോസ്കിനകത്ത് there are people doing the makeup for you, and those brushes and things we don't even know whether it's been used well or sanitized well.
I even tell my brides, patients who come to us who's preparing for their wedding, that get your own get your own set of beauty blenders and brushes. Like if you can't go to the extent wherein ennu makeup use cheyyunnavarunnavilla appo full set of brushes njan engane vedikka, okay fine, get your beauty blender. You have 4 events, you get 4 beauty blenders. കാരണം ഒരു കല്യാണം കഴിഞ്ഞ അന്നത്തെ ദിവസം രാത്രി ബ്യൂട്ടി ബ്ലെൻഡർ ഇരുന്ന് കഴുകാനൊന്നും ആരും ഇരിക്കാൻ പോകുന്നില്ല. So toss it, you use the other one. Yes, your makeup artist might get you a good new beauty blender. Maybe they might sanitize what they have and use. Why take the chance? You invest in that. Another thing I asked him to invest in is buy your own foundation. Invest in a good brand, which is hypoallergenic.
You don't have to really get the the big ones.
And nowadays you can go to a mall, try it on both sides of your face. You walk around for an hour and come back. If you have a sensitive skin, you will know, are you going to break out or not? You don't have to buy the whole bottle and then realize it didn't work for you. So the base things, that is your moisturizer, your primer, your foundation, get it yourself and keep it. So sooner or later you can always use it, and you're not compromising on the quality there. On the other hand, all that makeup products or palettes and all, it's okay. You can use what they are bringing in. Just personally make sure that the brushes are clean, the palettes are clean. That's very important.
And also about serums. There are a lot of serums in the market right now, like niacinamide, alpha-between. Lot of, with so many percentages up and down with all that. So if there is one serum that you would suggest for a normal combination skin, or if it's for an acne-prone skin, what is that one serum that
Hyaluronic acid.
Okay.
That is one serum that I can recommend for all.
Okay.
Which will not, and good percentage of hyaluronic acid which doesn't have any other hidden ingredients.
Okay.
Like there might be hyaluronic acid.
You want to see a particular product?
I know. So there would be hyaluronic acids in the market. I have personally seen it's written hyaluronic acid, this much percentage. You turn the bottle, you see different other ingredients with it. No, just pure hyaluronic acid. Yes, other serums you can use, provided it is for you. Provided that combination works for your skin. Chala products, like Indian skincare products itself, might not work for some people, probably because it has oils in it. But certain products would work for them because their skin needs it. So if you ask me one serum that everybody can use, that's fine. That's one thing that they can start with.
Hyaluronic acid.
I would any day say hyaluronic acid, because that helps in improving the water holding capacity of your skin. You have good hydration, you have the optimal level of
things are sorted out there itself.
Optimal level of I'm not even kidding when I say that. Optimal level of hydration sorts of a lot of things. I have seen acne is clear up with that.
Oh,
You know, ഇപ്പം നമ്മളിപ്പോൾ ഈ ഇത്രയും എക്സ്പോഷർ എന്ന് പറയുമ്പോൾ തന്നെ ലോട്ട് ഓഫ് പീപ്പിൾ ഹു യൂസ് സോ മെനി പ്രോഡക്ട്സ് അവരുടെ സ്കിന്നിൻ്റെ pH ലെവൽസും അവരുടെ സ്കിന്നിൻ്റെ മോയ്സ്ചറും ഓയിലും എവറിത്തിങ് ഇസ് സ്ട്രിപ്ഡ് ഔട്ട് ആൻഡ് ദെൻ ദേ കം ഇറിറ്റേറ്റഡ് ആക്നെ completely broken out. So what else can you give them? You can't again put them on an active. So then you pacify their skin, hydrate their skin, bring back that balance. Appo then our skin is less angry. Otherwise it's all red, blotchy, angry, you know. So this helps in calming it down. So that right level of hydration with the right product, internally and externally, helps a lot.
And any supplement that you would recommend for this age group?
Supplement I would recommend for this age group, check your vitamin D levels.
Okay.
Have omega-3. If you are someone who has good amount of fish and good amount of seeds, I'm not saying nuts, I'm saying seeds, then maybe you get your omega-3 from that. Otherwise, omega-3 is always a good anti-inflammatory agent. It even helps with acne. So I would say these two, like you don't need to like hoard on supplements. Or I have teenagers who come to me saying, Doctor, I am 18. I have to take protein powder. No.
You don't need
You don't. And they literally argue. So I don't argue with them. I smile and tell them, no, you don't need it.
You can actually go and check it if you really need protein, right?
Yeah. You can even measure the amount of water, amount of protein, amount of fat, percentage of visceral fat in your body, everything. We have an in-body machine at the clinic. There itself we tell them, you know. So it's not like, okay, my trainer told me I have to have it.
Protein,
So I had this conversation with Beeger the other day. So it's not like, you know, it's not the solution for everything. But if you need to have it, you can have it.
Yeah.
But
it's not necessary to have it just because you joined gym.
And that is not the first thing to do when you join the gym. You be consistent with everything else.
Yeah. So I think we more or less covered everything. And if anybody has any more doubts, I think they can comment below and then we will clear it in the next episode.
Yeah, definitely. Yes.